Everything going all right?
Well, great.
Okay. We get patients from Grayling all the way up to Sault Ste. Marie, Canada. There is a big difference between the dentistry that you do here versus private practice. Here, the dentistry is a lot more health-based. A lot of the time, it's patients who are in pain. They need it to improve their quality of life.
Private practices are a lot more preventative care, where here in a rural setting, we are more emergent care or reactive care. Our goal is to get them back in for a comprehensive exam, get them a full treatment plan, coach and teach them that you don't have to lose your teeth, that you don't have to go into a denture. Part of our collaboration that we have with the University of Michigan, not only is it meeting the needs of our patients for access, but it's also a gateway for the interns who are really getting that experience that they may not get in a non-rural setting, where they're getting that reactive care, where they're getting a patient that's in pain. Without our U of M interns, we honestly wouldn't be able to serve the patients that we do. They bring in an extra 18 patients a day for us, and we're getting roughly 48 new patients per week. It's really great that they're here and can help us service that need.
As dental students, we're all looking for more experience, and this is one of the more operative heavy rotations. So there's a lot of extractions, there's a lot of fillings, and also the mentorship here is really great as well. The biggest part of Atlanta for me has been the team atmosphere, and you can see with a really high quality team how well things run, and just being able to trust your assistants to bounce ideas off of other clinicians. That's been really influential in how I want to build my practice in the future. They're not saving easy procedures for us or anything like that. It's all, whatever comes in through the door, we have an equal chance of getting. It's a very real world experience.
My first experiences here at Thunder Bay was as an intern, and so the amount of appreciation that people showed was extremely rewarding. In that 2-week rotation, I changed my mind and I decided to come up here full time. And I realized that I just really liked Northern Michigan, as well as the community. When the interns come up here, I think they each see 6 patients a day. We do checks at every stage of a filling or extraction just to make sure that all the work is kept up to our own standards. That transition from having a dentist always look over you to then being able to practice on your own. Part of it is figuring out and tailoring your care to the people and figuring out what their goals are. Not just, it's not just a mouth, it's a person.